excited to present this presentation. My sister actually has this disorder, so it was very interesting to kind of go and take a scientific approach to understanding it rather than a biological familial approach. So what is this disorder? Functional neurological disorder. A look at a disorder the world knows little about. This is the order of today's presentation. We'll talk about what FND is. I will be calling functional neurological disorder FND because I'm not saying that name over and over again. Symptoms of FND, the causes and cures, treatments. This is management, not treatment, if you remember our talk from diagnostics about the difference between the two. Current research, and any questions, because I still have a lot of questions. So, starting with the name of the disorder, there's 3 vocabulary terms. Conversion disorder was the first coined term of this disorder by Sigmund Freud back in the early 1900s, late 1800s. It's a condition in which a person experiences physical and sensory problems. He believed that these physical symptoms were occurring because of major psychological trauma or stress, and the person was not able to cognitively process them, so they presented as physical features. Then you have functional neurological disorder and functional neurological symptom disorder, which are, in a sense, the same kind of thing. It's just the it's how if someone wants to be termed with a symptom disorder or a disorder. Both of them are a problem with the functioning of the nervous system and how the brain and body send and receive signals. So, symptoms of FND. There is a long list, which we will get into, and that list is given by the FND International Hope website. However, there are many more symptoms that aren't listed on there because research is so new about it. So, the first 2 symptoms are bladder and bowel changes, as well as chronic pain. Along with bladder and bowel changes, my sister also experiences, I believe it is called interoception or poor interoception, but that feeling of like you are hungry in your stomach, so your stomach sends a signal to your brain and your brain says, hey, eat something, you're hungry. Her body doesn't do that. Her body recognizes that there is something going on, but then when it sends it to the brain can't process saying, am I tired, am I hungry, do I need to go to the bathroom? So we've experienced a lot of incontinence episodes in our few years of this disorder becoming a part of our family. Chronic pain, that is pretty self-explanatory. No known cause as to why she's experiencing, or people with FND are experiencing chronic pain. It is just there. She says, I did an interview with her about this, that she is always in pain, that the pain levels differ each day. Next, you have cognitive changes, gait and balance issues, and headaches and migraines. Part of her some of the migraines can be caused by physical swelling in between the skull and the skin. So not necessarily like Hannah's chronic migraine presentation, but like a physical cause to these migraines. Gait and balance issues, I'm sure we're all becoming familiar with that with Vistib and what we've learned in here, but she had, people with FND have uneven balance, they have abnormal walks, runs, poor postural control, cognitive changes, dissociative amnesia, brain fog, memory loss, depersonalization. Someone with FND can have all of these disorders, they can have all of these symptoms, one of these symptoms, or none of these, or a few of these symptoms. It really depends on the person. Some more symptoms. There are involuntary movements, paralysis, and weakness, kind of going along with that gait and balance issues. This one, I forgot to add to I have it. You have tics and tremors up there too. You have spastic movements as well. Have been subject to victim of some of those. And paralysis and weakness that can occur throughout the entire body. Sometimes it can be just your lower extremities, sometimes it can be just your upper extremities, or it can be all of the above. You also have functional seizures, sensory changes, and sleep disturbances. So functional seizures is a big key symptom of FND, very different than epileptic seizures. you will have absolutely zero abnormal brain activity while experiencing a functional seizure, which is why it's very separate. Does not cause any damage to the brain or anything like that, but has a lot of psychological effects. She describes as being trapped in her body and knowing everything that's going on around her, but not being able to stop the seizures. I have some videos later where we will be able to see that she is cognitively aware of what is going on, but has absolutely no way to stop it. Sensory changes, she, specifically my sister, but other people can experience partial blindness, tunnel vision, different proprioception.
There's nothing playing.
Oh, sorry. That was my phone. Shame on me. Sound, touch, taste, and smell, all of those are affected. One thing I want to note with these symptoms is that they do, besides some of the chronic pain and the bladder control issues, they do come and go. So it's not like sound, touch, taste, smell, and sight are always affected, but just are experiencing it. Sleep disturbances, given in the name, but sleeps for long periods of times or doesn't sleep for days at a time. Depends on the person. Visual changes and speech problems, those I feel are pretty self-explanatory. Sometimes she has expressive issues, sometimes she has perceptive issues. It was pretty interesting in the beginning of this disorder. We found that when she was in a functional seizure episode or a dissociative episode, kind of doing some of these speech therapy exercises that I learned in undergrad helped. Just kind of asking basic questions and having her repeat it back, or really having her focus on the articulation of a sound to kind of distract the brain from what is going on. Temporary blindness, diplopia, photophobia. So, all that being said, what parts of the brain are affected? Before I continue, fun fact, all parts of the brain are affected. So we have the prefrontal cortex, the visceral system, the frontal lobe, the cerebellum, the hypothalamus, the brainstem, the temporal lobe, parietal lobe, occipital lobe, and Broca's and Wernicke's area. So easy to say that all lobes of the brain are affected, as well as certain parts of each lobe. However, this is far as research goes into how the cranial nervous system is affected, because there are no tests, there are no imaging. Like I said, you don't see any abnormal brain waves when monitoring the seizure. There's no spots in the brain that come up. There are no blood tests, anything like that. So that's as far as research goes. We can say that these are the symptoms. We know that this parts of the brain control this part of the symptom, so therefore this part of the brain is affected. That being said, causes of FND. There are no known causes of FND. It is believed to be an underlying condition that becomes active. I talked about in the beginning of my presentation that is a type of conversion disorder as coined by Sigmund Freud, and it is brought on by stress or trauma. There is current research being developed that COVID-19 can have is playing a role in the diagnosis, or not diagnosis, but I talked about how it is an underlying condition that becomes active, that someone who had COVID-19 who also had this underlying condition, it is now becoming active because of COVID-19. We know how COVID-19 is being linked to affecting some parts of the nervous system. It is brought on by stress or trauma. That is, so the difference between a conversion disorder and FND is that conversion disorder is brought on by significant trauma. However, there is not a measurable scale of what is significant, because what's traumatic to one might be not traumatic to the other. So it is also believed that FND is caused by trauma and stress, however, not coined significant trauma or stress. There are currently no cures, only treat or management methods, and those management methods involve many different types of therapies. So, this is a quote that you will find on the FND website. Medical professionals often have little understanding of this disorder and do not understand that it is a common severe disorder that is not under the patient's control. For the past 2 or 3 years, we have been told that my sister just needs to go to therapy and work through her problems, and if she just talks about it, then her symptoms will go away. We are now probably one of the closest families in the world, and I will tell you that the symptoms have not gone away. So this whole just talk about it kind of philosophy, and that this is what she's been told by doctors for 2 years now, is the most aggravating thing to possibly hear. Because if she didn't want to experience these symptoms, she wouldn't be. No one wants to be 19 years old peeing their pants. So, that being said, there are currently only 9 research labs in the world studying FND, and approximately 7 of those are located in the UK. 2 of them are in the US, I believe, one in the Midwest and one on the Western coast. But let's look into what those research labs are looking at. So we have the first 3, impaired self-agency and functional movement disorders, neural correlates of recall of life and conversion disorder, a preliminary investigation of sleep quality in FND. I'm going to go through all 9 of these before we talk about them. We have life events and escape and conversion disorder, research functional neurological disorder, research fibromyalgia, and then research functional dystonia, research occupational therapy consensus recommendations for FND, and research dissociation and interoception in FND. Basically what I have gathered from looking into these research labs is that they are all aimed towards how can we manage FND better. Currently none of them are looking at known causes, nor are they looking at cures because of the vast unknown about it. There is controversy in the scientific world whether this is a neurologist issue or a psychologist issue. Who should be studying it? Who should be finding the cures and treatments? Because there's this controversy, no one is. So instead, we're just looking at ways on how we can live with it. So talking about some treatments, we have medication, physical and occupational therapies, psychotherapies, and a little bit of some other stuff. So medications are primarily for the chronic pain, managing that, managing anxiety and depression, as well as appetite control, because some of the depression and anxiety meds that they are put on affect one's appetite, whether it's an overabundant appetite or no appetite at all. Some physical and occupational therapies, those begin after the diagnosis of FND. It stems from having those gait and balance issues, as well as visual and speech and all the other symptoms we talked about. So a good part of her occupational therapy was learning to control her bladder again. Whereas her physical therapy, she at first, before the disorder, she was running 13 miles, and then at her physical therapy, she could only walk 5 minutes at 2 speed before she fell into a functional seizure. Some psychotherapies include CBT, hypnotherapy, EMDR, which is that light you're supposed to look at the light and you're following it back and forth, and before this light turns on, you express a traumatic experience that you would like to dive into to talk about. So then as the light goes back and forth, you follow the light back and forth, and the therapist is walking you through that traumatic experience, trying to desensitize you from it. You also have family-centered therapy. I'll tell you that is not enjoyable, but it is beneficial. The going comes off of the trauma and stress type of thing. Then you have some other type of treatments. So began lidocaine injections to try to help with the chronic pain and the migraines. A cephaly machine, which is like this take-home electroshock type of therapy that she would put on the front of her head, and it was to help with migraines and help that swelling that I talked about earlier between the skull and the skin, as well as she's beginning a ketamine trial to help with the chronic depression that has occurred because of the FND. So up next, I have some example clips. I think this really helps kind of take a look at this isn't she is who she is, and then FND is separate from her, it does not make her up. I will give a viewer discretion warning. There are there you will see a clip of seizures and dissociative episodes. So, put that in there, be friendly. So this first one, if you can see, I don't know if you can see it in this picture, very, very poor handwriting. This was when she was in a dissociative episode where she was not able to speak to us, but she was able to write out what she needed from us. And she was cognitively there at her cognitive age. In this video, I'll turn. You can hear it in her voice.
Or you can just show it to him. Yeah, we can send it to store, or we can just show it to him.
We won't watch the whole thing.
You want to give me another body? No? Or, why are you going to give me another body? Because you're one of the articles of fucking house.
Pardon my French.
No. Don't fucking hit me.
So you can tell in this video that how I perceive it, how my family perceives it, is that her verbal speech is kind of similar to like a 5 or 6 year old. Not that she is that she is a 5 or 6 year old, but you can hear in the articulation and her structure of sentences, the inability to stay in the flow of conversation. We were talking about one thing and then she talked about getting a bunny. The hitting me is part of this like spastic movement as well as the cognitive effects and the activity of let me show you how strong I am by falling off the bed and using my abs as I lift her up. All are coined under the term a dissociative disorder. So then if we go to the next one, this is what a non-epileptic seizure looks like. I'm going to fast forward to where it becomes a little more interesting. So here my dad and I are trying to figure out ways to help her get out of this seizure. She has a weighted blanket on her. She had a weighted blanket on her at the moment, and then we removed the weighted blanket and she was really hot. We have learned that heat really exacerbates all of these symptoms. So now my dad and I are trying to talk to her and trying to see what she needs from us. And if I fast forward a little bit more, she's telling my dad that she wants to eat. So then my dad tries to help her sit up. And we are trying to pull her up and her body, every single one of her muscles in her body is locked and constricted. She is not moving. She gained so much muscle tone during this disorder without doing a lick of physical exercise in the gym because of the muscle contractions and the seizures. But in that, she was cognitively there. She wasn't, as we look at the past video, she wasn't presenting as like a 5 or 6 year old. She was her normal age self, but she was trapped in this locked body. I have a couple more. This is a paralysis episode. You will see momentarily, she goes to work every single day as a ABA for kids between the ages of 4 and 15. And that's a challenging job in itself, let alone to have your own disorder. But you can see here that her hand is locked in this position. She absolutely cannot use it. She actually uses her mouth to pull the seatbelt down. But then she is, unlike the first video, she is cognitively there. She's aware of everything that is going on, yet she can't get out of that paralysis episode. And then the last video I have is some tremors, which she almost experiences daily, but you can see the shaking in her legs and her ankles, as well as in her fingers right here. And in her face, apparently. She loves to videotape herself. So, those are just some examples of some of the symptoms that she experiences. In our time as my family, we have learned lots of ways to help manage these symptoms and to help make sure that they don't come about, but the biggest one is accepting them and not shaming and not blaming and not getting frustrated for these symptoms occurring, because as frustrating as they are for us, sorry Ty,
No, you're good.
they're even more frustrating for her and anyone else with FMD. And that is my presentation.